Hi, good afternoon. My name is Nanno van der Laan, and I'm going to discuss and show you what we do to make healthcare smarter. And with healthcare smarter, I mean give the people better lives and also improve on the healthcare system. Now, if we look at healthcare and the people in it, then we see that parents, especially parents, spend a lot of time finding out about their kids if something happens to them. And they really care about their parents and trying to figure out what is happening to their parents, especially in cases where they live in remote areas, which is very often the case. And I think that we should address the needs of parents to make healthcare smarter, safer, and a cheaper place for all of us. Now, how do we do this? Not by asking the parents to enter more data. No, we want to provide them with the tools and whatever is needed to gather more data, to give them more insights into the behavior patterns of their children and their parents. Their parents, yes. We also want to be able to smoothen the communication between doctors and patients, because in effect that saves a lot of time, saves a lot of energy. So I think the knife cuts two ways. Because of this thing, we provide monitoring wearables. They're our wearables. We provide a solution which I think will be the cornerstone of the new healthcare as we will see it in a couple of years from now, let's say 4 years from now, which is like a person-owned dossier. And with person-owned dossier, I mean it's personal, it's yours. Now, why did we come up with this solution? In the Netherlands and in many other European countries, and maybe the exception is Denmark, we face an increasing lack of innovation in the healthcare industry. It's basically controlled by the big healthcare system providers, and they're not really eager to change their business models, which is what we're doing. We're bringing innovation. Taking advantage of the innovation will be the wearables. They're an increasing part. I think everyone on stage here recognizes it, everyone in the audience knows about it, and the wearables will really have a dramatic impact on healthcare as we know it. We think that the healthcare industry today, as it is, still is an important player in this market. So we addressed in our talks 5 insurance companies of the Netherlands, 2 of which are already agreed to make our solution, or our solutions I should say, part of their cost saving and caring care. As I mentioned before, we see the doctor as a cornerstone, as a hinge in the medical system. Which means that we work closely already with doctors, even before going live, in creating a platform for them for easier communication and gathering more data between them and their patients. Now, what is it that we actually do at the final solution? Because I haven't mentioned that. What we provide is a range of sensors that we develop ourselves for children, for our parents, and for epileptic patients, because they're a special brand of people that really need curative care. But we also recognize the need for other devices to provide more information in order for people, the parents, or doctors to make better decisions. More information from more wearables provides more context. So we have an open platform that allows a number of devices and even apps to connect to our platform, and using smart rules, and this is we think it's a really smart system, because we can really create new applications in about 20% of the time, so there's no programming involved. And what we do is we output that data into graphs on a situation where we think an incident occurs. So we've got this smart logic, both at the device side and at the portal side, that will alert you and share information with you. Now, where we will make our money? Obviously from selling our own wearables. We will use a subscription model, make money from that, and we will sell our platform. We already have some partners that have shown interest in it, and we think we can really make the difference. Our go-to-market strategy, we already targeted the Dutch Doctors Association. We already have approval from 2 insurance companies, and I expect a 3rd one to sign up with us by April. And we target like the patients groups. And this is actually a model that we can easily extend to other countries in Europe. Now, the difference is that we are not like Philips, a pure medical company. So we don't necessarily, except for the epilepsy part, medical approval. For the epilepsy part, we will get CE approval, which we need, because we will roll out in Europe. We will roll out in 10 countries in Europe only. I really want to share something with you on our team, because it's me on stage, but a lot of people that make this come true. And I think we have a very well-balanced team of technicians, medical people, and people with in-depth medical history on epilepsy to make this come true. Okay. Thank you very much for your time.
Great. Thank you, Nanno. Are we joined by Minter?
The prototype and the new designs.
So
okay, the final round of questions from our judges, please.
Yeah.
So
I won't leave stage.
So the questions here are, I had a quick question on, so the business is actually doing a wearable, right? That's your business. And the subscription is the revenue?
There's two. It's,
okay.
We're doing the wearables plus the platform.
Okay, and so can I do the wearable and not have, I need to have both, right?
Yeah,
platform.
if you would definitely need the platform.
Okay. And then this...
Platform powers it all.
Okay, and then globally, where are you finding that you're having the least amount of friction to integrate? Because like in the US, FDA compliance, HIPAA compliance, this is, if a physician is reading the data, it has to be locked down, right?
Yeah, but we're not targeting the US. So our markets are the 10 countries in Europe, which we have identified, we've done market research on, and the African continent. So we're not moving to the US.
Got it. And are there any friction points in Europe that you're finding?
No,
compliance-wise?
Like in the Netherlands, we work with neurologists from the University of Utrecht to make this come true. Because from this, we gather a lot of inside information, and we're actually going into the area that we want to be more predictive. We do already have the decision support in place, but we want to be more predictive. So we're working with neurologists to help us add value to that data. It is very specific data. It's not data you can fetch on the web from the search engine.
Got it. And then, say like my parents are really, really old and they suffer from dementia. So sometimes they take off these devices.
Yeah.
So what are your thoughts there, and what kind of mechanisms are you looking for?
We're not talking dementia people. I know there are some wearables that will give a warning if you try to untie them, and this is exactly why we say there's a lot more to it than just our own wearables, and this is why we sell the platform. So any company that has a great idea, and even a company here in the audience, if they have a great idea of having a wearable, we provide the software platform to implement all the logic in, let's say, anything between 3 and 6 weeks, and make it really operational.
And do you see yourself white labeling it at that point, or do you want to build your own brand?
No, well, what we do is in the epilepsy part, we don't want to send it out at different labels, so it's got to be recognized. And what and we're actually talking to IBM about this. We see that as an ecosystem, so not a technological ecosystem, but actually an ecosystem for epilepsy to build a better epileptic world. So, and we think we're better off with one brand. Any other company that wants to do it, there's one here on the stand that has shown an interest, we white label it.
I'm wondering which is the balance between the wearable revenue and the platform revenue, your forecast, more or less.
Okay, that's the one I had shown, but we make less money on the platform because we expect to sell less platforms in Europe than we would make on generating revenue from wearables. It's a higher margin, it's an easier to sell product, whereas the platform, there's also technology sales involved. And I forecasted 20 based on what we researched. If I would double that 40, then I would be very, very happy, but 20, I think it's a realistic figure.
Okay, great. Thank you very much, Nanno.
Oh, sorry for your... Time for one question?
Oh, is it a quick one? No? Okay.
2 less seconds, so it will not finish.
Yeah. Okay. Thank you very much.
Okay, thank you. The clicker. Thanks.
Thank you.